Hi, I'm Dr. Cassi of Vet2Vet and host of this V2V video series sponsored by Boehringer Ingelheim Animal Health. V2V will feature conversations between myself and Boehringer Ingelheim veterinarians on a number of medical and surgical topics and the medications specifically designed to address those topics. Joining me today is Dr. Danny Joffe. Hi, Dr. Joffe. Thank you so much for being with me.
Oh, my pleasure. Thanks for having me.
We're thrilled to have you. And Dr. Joffe is the Vice President of Medical Operations for VCA Canada and a clinician at VCA Canada Calgary Animal Referral and Emergency Center. So thanks again. We're so happy to have you.
I love these programs, so I'm really happy to take part.
So for this talk, we're taking a little bit deeper look at two of the Boehringer Ingelheim animal health medication brands designed to help veterinarians and pet owners alleviate some of the pain and inflammation associated with osteoarthritis. And that's Medicam and Previcox. So Dr. Joffe, let me start by asking you this. We know that the best way to manage osteoarthritis throughout a pet's life is to create this environment that kind of fosters proactivity. So it can be hard to talk to pet owners about osteoarthritis early in their pet's life. What recommendations do you have for talking to pet owners about osteoarthritis early in life?
Yeah, and a significant percentage of dogs already have signs of arthritis in middle age, especially large breed dogs. So it is critical because we want to catch the disease as early as possible, and that gives us the best opportunity to efficiently manage the disease moving forward. I talk to clients about arthritis, especially in large breed dogs, early on, and I give them the signs that I want them to look for. Trouble getting up, going upstairs more slowly, maybe lying around after a period of intense play. Those can all be early signs of arthritis, and I try and educate the clients about that, because again, if we catch it early, we can manage it better, and the pet will have a better long-term outcome.
Yeah, it's really surprised me in the clinic how many large breed dogs I've seen with early osteoarthritis. I mean, much earlier than I would have expected.
Yeah, and it's, again, we think of osteoarthritis as an age-related disease, but don't forget, there's those breeds that are prone to hip dysplasia or prone to elbow dysplasia that can start showing significant signs even at an age of 1 year old.
Absolutely. And it can be really hard to diagnose this process in its early stages. So what are some of the more subtle signs that you look for in younger dogs?
Yeah, what I look for is, first of all, I'll do a gait analysis. I'll go outside the clinic where they can move a little more freely, and I'll have the client jog them back and forth, much like an equine lameness exam. And so I'll do that. And then as part of my good general physical exam, I'll specifically do a good orthopedic exam. And one of the tricks that I look for in the orthopedic exam is looking for any subtle muscle atrophy. So on the back legs, I'll put my fingers around the thigh musculature, and I'll gauge on each side. Maybe one has less muscle mass than the other side, and that could be atrophy because they're not using that leg as much. On the forelimbs, I do the same thing, looking at the musculature of the scapula. And I'll feel the muscle on each side of the scapula. I'll feel how well I feel the scapular spine. And if on one side that scapular spine is sticking out more abruptly, again, that's early muscle atrophy. And I'd recommend to the client that we get a radiograph to nail down, is there arthritis in one of the joints of the forelimb or the hind limb, or is this something else? And so I'll tell the client why I'm doing all this. And when you give them the why, they're often a lot more compliant.
Sure. And some of those subtle signs can really help us with that proactive approach that we've been talking about. And kind of along these lines of proactivity, we know there's some good strategies that we can use in our patients, like keeping them at a healthy weight. But how does the use of long-term non-steroidals like Previcox or Medicam play in?
Yeah, and that's a great question. Now, the best way to manage osteoarthritic pain is with multimodal management. We don't want to just use one thing. Things like you mentioned, weight loss, joint diets, nutraceuticals, physiotherapy can all be very beneficial, but none of those are analgesics. And this is a painful condition. That's why I always incorporate an NSAID like Previcox or Medicam into the management of arthritis. We need to snuff out that pain and inflammation. Those other modalities over time will allow us to decrease the dose of the NSAID to the least amount necessary for each pet. But again, it's critical that we include anti-inflammatories and analgesics into this plan, and that's where drugs like Medicam and Previcox fit in.
Sure. Do you have a patient that you can think of, recently that you had some really good results with using these medications for?
Yeah, I had a dog. It was a couple of weeks ago. It was a 12-year-old Labrador Retriever. And the client just thought he was walking funny. He just thought that as he was getting older, he was stumbling a little bit on his hind end, had trouble getting up. Some of the classic things that come along with arthritis. And I talked to him, and we went through what arthritis can do. Turned out has a badly arthritic hip and knows how much that hurts him. And in just bringing his concern of his own arthritis, he says, "Oh boy, my buddy must be in a lot of pain. Let's do something about it." And we got him started on Medicam. And within a couple of weeks, the dog was a new dog, and the client was exceedingly happy.
So I can relate to that actually. And it leads into one of my other questions. With my own dog, unfortunately, I'm a little embarrassed to say that I waited probably longer than I should to address her arthritis. And I had some of the same thoughts. She was stumbling a little bit, she was walking a little funny, but she's older and she's just kind of slowing down. How often have we heard that? And then when I finally did put her on anti-inflammatories, the same sort of situation. I mean, it was a huge difference. I felt bad for waiting that long. So how do you talk to owners like me who are having a hard time accepting that their pet is dealing with this chronic and progressive process, and are just kind of attributing it to, oh, they're getting older, they're slowing down, that kind of thing?
Yeah, and that can be a tough discussion. But what I try and do is be a team, have the client be part of the team. And what I'll tell the client is, I understand you know him a lot better than I do, and you don't think he's painful. But my exam tells me that I'm worried that he might be. Unfortunately, Apollo can't talk for himself. What I want to use is this medication, be it Previcox or Medicam. I want to use this medication to speak for Apollo. I'm going to send you home with 2 weeks of medication, and let's book a recheck appointment 2 weeks today, and you'll come back and you'll tell me whether Apollo needs the medication or not. Invariably, 2 weeks later, I walk into the room, and before I can say anything, he says, "I need more of that medication." And that's going to drive compliance, right? When a client tells you they need the medication, they're going to be a lot more compliant than the client that I keep telling they need the medication. So I use that, let's let the medication speak for your pet, often in the exam room.
Absolutely. And kind of getting into the medications themselves, we did in our first talk, we talked about the benefits of Previcox and prescribing that postoperatively for soft tissue or orthopedic pain and inflammation. What are some of the benefits that are specific to Medicam?
Yeah, I think Medicam has two major benefits that other NSAIDs don't. The first is the ability to get the exact dose every time, and I'll talk about that in a second. And the second is because it's a liquid, we can painfully slowly decrease the dose over time and find each animal's lowest effective dose. And so we can do that because we can go in baby steps that you can't do with a tablet form of an NSAID. Now, for when we're using a tablet NSAID, we know the weight of the dog, we know the dose of the drug, we punch the numbers into our calculator. How often does it work out to exactly one pill, right? When it does, you want to go out and buy a lottery ticket because it has to be your lucky day. Instead, as a clinician, we're forced to make a decision. Do I underdose that might affect efficacy? Do I overdose that might affect safety? With Medicam, you never need to make that clinical decision. You get the exact dose every time. It's the dog's lean body weight on the syringe. If you have a 40-pound dog, it's the 40-pound dose on the syringe. And that's important to dose to lean body weight. All NSAIDs are heavily protein-bound molecules. And heavily protein-bound molecules don't penetrate adipose tissue very well. So if we have a 95-pound golden retriever, there should be an 80-pound golden retriever. If we give that medication that we give the dog is only going to the 80 pounds of dog, it's not going to the extra 15 pounds of adipose tissue. So we should dose all NSAIDs to lean body weight. As I mentioned, the second benefit of Medicam is the ability to effectively do lowest effective dosing, where we slowly decrease the dose until we find each dog's individual lowest effective dose.
Yeah, I love that idea of being able to dose exactly what they need and no more than that.
Yeah, and I use that with clients a lot, and I'll say the neat thing about this medication, Medicam, is working together. We're going to be able to find Buster's exact individual dose. And I explain, we're going to start at the label dose. That's for average dogs, but Buster's not an average dog. He's Buster. Working together, we're going to slowly decrease the dose until we find Buster's individual lowest effective dose. We're not giving him a milligram more of medication than he needs on a daily basis. Clients like that line of thinking, and it makes them more compliant. Anything we can do to get our clients to be part of the team will enhance compliance. And enhanced compliance gives us better medical outcomes. So it's truly a win-win-win.
Absolutely. Teamwork and client compliance, two things that are essential for managing osteoarthritis.
Exactly. And let me just talk about another point with Medicam, and that is the dosing. The dosing for Medicam is 0.2 milligram per kilogram the first day, and then 0.1 milligram per kilogram thereafter. Why that 0.2 milligram dose first? Well, if we give that 0.2 milligram dose first and then follow it up with 0.1 milligram per kilogram dose moving forward, the drug reaches a steady state and is more effective earlier that way. Now that double dose, so a 40-pound dog, we get an 80-pound oral dose, and that can be confusing for clients. So I like to use injectable Medicam in the exam room. Injectable Medicam is low volume. It's the same viscosity as saline, so it's easy to inject. I can give a painless injection with a 25 gauge needle, and it can be given intravenously or subcutaneously, and it works very quickly. I give the first dose by injection because it obviates the need for that first double oral dose, which can be confusing to clients. So the client's just on the one dose forever. The second reason I like to give the injectable in clinic is that it works quickly, and clients need that instant gratification. And if I give it intravenously, the dog's going to be moving better by the time the client leaves the clinic. If I give it subcutaneously, by the time they get home, it's on board and working. And the dog runs up the steps better than it has in months. And the clients, wow, this pain management program is going to work because they've seen it from just an hour of having the medication. And again, compliance goes way up by doing that. So I really like to use injectable Medicam the first day because it obviates the need for that first day double dose, and the clients get that instant gratification that builds compliance.
So I have two thoughts. One is that I completely agree with you that seeing is believing, and getting that response really quickly is a huge driver of compliance. The second is IV. The IV is news to me, new and exciting. So you can give the Medicam IV in the exam room?
You can, and it works very quickly, IV, and it's very safe. It's been on the label since it came out, but I think most of us don't read the complete labels in a lot of cases because we just get using it one way. But yes, it can be in dogs, it can be given intravenously or subcutaneously.
That is really exciting. What are some of the considerations that we should keep on board before we start a drug like Previcox or Metacam?
Yeah, so there are some contraindications to using an NSAID, and that would be things like hepatic dysfunction, renal dysfunction, GI upset. Just those aren't good cases to use NSAIDs in. Obviously, if a dog's on another NSAID, we don't want to start a second NSAID, but sometimes we don't know. And so we really have to ask our clients, are they on any medication? Some clients give their pets aspirin and they don't even think it's a medication. So we really have to be certain of that. They can't be on glucocorticoids concurrently. That would be contraindicated. And then another contraindication would be Cushing's disease, or if they've had adverse events to other NSAIDs historically. There are some dogs that just cannot tolerate an NSAID. I always like to get good blood work and a urinalysis done before I start an NSAID, just to make sure that none of those contraindications are present there. The other thing I do is I really try and encourage them that they should only give an NSAID if their pet is feeling well. If they're not eating or drinking, they shouldn't give an NSAID. That's where we get into trouble. And eventually we blame the NSAID when it probably wasn't the NSAID's fault. So on my label, on my prescription label, it will say Medicam, give as per 40-pound dog, give only if eating and drinking. So I tell the client over and over, you can only give this medication if he's eating and drinking. If he stops eating and drinking, stop the medication, call the clinic, we'll find out why he's not eating or drinking and get things started again. But that's where clients get into trouble. The dog gets into the garbage and starts vomiting. The next day, he's not eating. The next day, he's not drinking. And they say, boy, he looks awful. And so they give him a double dose of the medication because they think he's really painful. So I really encourage clients that if they're not eating and drinking, you cannot give an NSAID.
Absolutely. Well, Dr. Joffe, I think this has been a great talk. I mean, you have some fantastic tips for client communication, compliance, teamwork, and we've learned some great things about Medicam. So thank you so much for being a part of this.
Well, thanks again for having me.
And thank you to Boehringer Ingelheim Animal Health for sponsoring this series on managing pain and inflammation in dogs. And remember, if one animal is better off because of you today, it's a great day.